Good morning and welcome to Waking Up with Don. This morning I have a fella here who I think you ladies will be particularly interested in meeting. I have Dr. Ceydeli from the Plastic Surgery Institute and Spa here on the couch and Waking Up with Don. Good morning, doctor.
Good morning, Don.
Thank you so much for coming on the show.
Of course, thanks for having me.
Yeah, people have a lot of questions about plastic surgery.
Sure.
And what people see on TV and in the radio, well, you don't see anything on radio, but you hear about on the radio is these celebrities that overdo it. And you hear these plastic surgery horror stories. Is there anything to that? I mean, is that widespread, or is these just exceptions to the rules?
Well, it's a trend slowly diminishing. And I would say it's both from the patient and the surgeon's fault. And anything that we do, it should be natural. You know, we want to make people look their best, more refreshed. But at the end, they have to look natural, no matter what you do, from face to breast to tummy. And I really blame my colleagues with that, because patients come to you, they want to look better. That's why they come to a plastic surgeon, board-certified plastic surgeon. And when they get that kind of result, they think that that's the norm, and they look around in Hollywood or even some local areas here, and they think that that's the norm, and they accept that.
Do you ever have anybody come in and say, hey, make me look like Angelina Jolie?
You know, no. I get that question, but I never had one of those patients. Usually, I'm glad, I'm lucky, I guess. My patients are really well educated and realistic, and they, study me and my website, my results before, and they really want specific requests. But I don't usually get anyone that they want to look like someone.
Yeah, because that would be a red flag, wouldn't it, for you, if somebody said, hey, make me look like someone I'm not?
Yeah, the request is they bring their pictures from when they were 20, 30, and they say, this is how I look at my cheek, and that's quite reasonable, and that's quite achievable. But usually people don't want to look like someone else. Actually, they don't want to even change their appearance.
They just want to look their best.
Refreshed.
Or look
well
like they
rested,
used to look.
They used to look, yeah.
Now, what's your typical patient? Is it predominantly female, or are men doing this more often? Well,
they are doing more often. As a matter of fact, right after here, I have a gentleman that I'm going to do a facelift in the office.
Excuse me, a disclaimer, it's not me. Somebody else.
Because you don't need it. That's why.
Exactly. Yes. I had a professional opinion right there.
But yeah, it's hit or miss.
Yeah.
Compared to females, yes, it's much less. But compared to 2-3 years ago, the men much more common right now, as well as in my practice as well.
Are there people that you won't do a procedure to? Are there people who are just bad candidates?
Of course. If they are not healthy with their heart, lung, there are any medical issues going on, I won't even touch them. Doesn't matter what it is. So, and if the age is not the limit, if they are healthy, I was just telling you earlier, one of my recent patients that I did a facelift was 73. Wow. She's healthy, no problems, no medications, and she looks great. Why not?
So age is not a barrier then?
Age is not, but the health, medical condition is a barrier.
That's interesting, because you see people like Joan Rivers, who's probably about, she's about 200-300 years old now.
I didn't do anything on her. FYI.
But she's tight as a drum.
Yes.
She's going back a lot.
I mean, you wanna age as well. So that's good. You can look good at any age. And when the patients come, I don't promise them that you're going to look 20, 30 years younger, really tight. I just tell them that I can make you look well-rested, more refreshed. And you're going to enjoy looking at yourself in the mirror in the mornings. You're going to use less makeup. So a combination. But I never say if someone comes 73, I'm not going to make her, I can't make her look 50. That's just unreasonable.
Right. Well, I do want to talk about, and we have to run off to a break.
Sure.
But on the other side of this break, let's talk about what people would experience if they walked into your office for a consultation and how all that would go.
Sure.
Welcome back to Waking Up with Don. I am here with plastic surgeon, man of medicine and man of science, Dr. Ceydeli. Doc, again, thank you so much for coming on the show. What would someone experience if they walk through the door of your office? I mean, you would have to make an appointment first, I'm sure.
Sure. Well, we have an easy number anyways, 850-NIP-TALK.
That's what I saw that.
That's right. So after the appointment, when they walk in, they're going to meet my family first. because really we are like a small family there in the office, really fun. And then they are taken to the back, and I meet them, and then we start talking just face to face, answering their questions, concerns, and we look at some before and after pictures. It really is a very family-oriented consultation.
Put them at ease at first, and then you try to gauge what their expectations are.
Yeah, there are a lot of things that we could obviously talk from face, breast, tummy, and sometimes they just write breast. But there are so many things that we can do in the breast, so we start talking into details. And sometimes they come for a breast, and for some reason they see that we can do a lot of other things, and we may be doing a face procedure before the breast. So we can talk about anything pretty much when they come.
Now, when somebody goes to your office, when I think plastic surgery, and I think a lot of us do, we think it's like a fabulously expensive thing to do. Are all of your patients wealthy and rich?
Well, it's all relative, I would say, but most of my patients, I would say, middle class, working class people. I treat a lot of military wives, working class people. Yes, I have probably they are very wealthy patients as well, but most, I would say, probably like 80%. Is the middle class.
So it's really just working people for the most part.
Absolutely, yes.
So it's something that is not, unreachable for your average
I guess not,
person.
But who am I to talk? Yeah. So I respect everybody's finances. Of course, it's an expense, but a lot of people do a lot of things. You want to drive a car, you get your hair, nails done. This is something that almost permanently improve your appearance and make you feel better. So
people spend a lot of money on a lot of different things.
Yes.
Like cars and homes and private schools for their kids or things like that. So this would just be another.
Well, kids come first, probably.
Yeah, naturally. But, hey, Sonny, you're going to public school. Mommy needs a facelift.
Yeah, my kids go to public school, and that's perfectly fine. So it's all good.
It is. So, and the whole school thing is a whole other show.
That's right.
So people can feel confident going in that they're going to be treated with respect and that you'll appreciate their point of view.
I think one field, maybe it's my personality, but I really enjoy the consultations, interacting with them. That's why I don't go out partying, because I feel like when I go to office, that's my partying. I meet different people. We talk about different things. I have fun, and I can tell that they feel comfortable as well. Maybe that's why we are doing well and we are getting good results, but really it's a fun conversation.
It does sound like a fun place to work. It is. Those have to be the coolest scrubs I've ever seen.
Sorry, I should have put on some suit maybe, but I'm going to my surgery after here. So
this is your go-to-work uniform, I suppose, right?
It is, yeah. It is.
That's awesome stuff to hear. Now, your training, you're a professional. You went to school to do plastic surgery, I would imagine. So
many years of schooling.
Yeah.
After medical school, I completed a master's actually in scarless wound healing in New Jersey. Then I started my general surgery training, which actually I'm a board certified in general surgery as well, but I never practiced. Then I started my plastic surgery training, and that was not enough, so I went to Hawaii to do my aesthetic fellowship. So that was
that was like rough duty.
It was good. Can't complain.
So if people want to find you, we can find you on the internet, right?
Sure. It's again, my website is easy. Either Ceydeli, my last name, Ceydeli.com, or 850niptuck.com.
850-NIP-TUCK. It's as easy as that.
That's right.
Dr. Adil Ceydeli, thank you so much for coming on the show.
Appreciate it. Thanks for having me.
And we look forward to having you back again real soon.
I would love to.